Hello, everyone. This is Brennan Hodge, and this is our Health Talk number 18. We're going to talk about direct primary care and Medoplex and free market healthcare systems. And I just want to dive right into it and start talking about first of what we have planned for direct primary care and the free market healthcare system with Citizen Health and what we've been building. I'm going to share my screen and kind of lay out some of the working models and screenshots we have now, and just to kind of fire up any ideas somebody might have, just kind of chime in and say yay or nay. I love it. Here's an idea. Let's just kind of riff on that for a little bit. Then I really want to get into direct primary care and talk about the growth of that and what everybody sees as working. And we had about 6 other direct primary care doctors that were supposed to be joining us. I was really hoping they would have some time to share their insights into this, but it's growing. People are starting to catch on to this, and really 3 p.m. in the afternoon, it's difficult. I know a lot of patients like to show up at 3 p.m. So I thank you for who could show up today. So I'll get straight into Medoplex, and let me share my screen.
For the new attendees, could you describe Medoplex?
Sure. What we're doing here at Citizen Health, we're really focusing on 2 core developments. One is a market, and it is designed to enable affordable prices for care for everyone. And the second is Humanity. It's a health operating system that's designed to improve our health that we already have. So for Medoplex, we'll be launching this later in January, if not February, a few pilots. And this is, you can think of it like an Amazon for healthcare procedures, where anybody with a healthcare need can go and discover and search for procedures for cash pay pricing. Everything's transparent, and they can purchase that directly from the healthcare provider, whether it's an imaging clinic, a surgeon, any physician that offers their services. They can come and transact directly without having insurance get in the way. So our first use case are going to be people with high deductibles that are paying out of pocket and then do need to go get MRIs or some type of X-ray, imaging, ultrasound, and they are paying out of pocket. And they're willing to shop around and find the cheapest price. And also for surgeries. A lot of times people are paying out of pocket for surgeries, and that target market would really look like it self-funded employers. And when they're writing their own checks for surgeries, that's going to be the first pilots that we do run, and also with direct primary care. So DPC physicians can start coordinating care with specialists and have everybody on one platform to coordinate with that patient, to collaborate and communicate. So that's it at a high level, and I'll share my screen and kind of bring all that in. So you should be able to see this now. This is actually the working site. Now, keep in mind, this is completely just a development server. Everything is, it could break once I refresh the screen. This is being updated a lot, often. And the design's not there and the copy's not there. So, and also the search results aren't accurate. So don't put any, don't think too much into that. So this is the idea: is you come here and you search for an X-ray, MRI, whatever you're looking for, type in your zip code, and the results would actually just kind of lay out here. And you can search per location on your body, return a list of particular things that are associated with that part of your body. And let me just hop into here. And once you do select, say I do want a biopsy, or I don't know what that's doing on there, but let's just say, once again, these prices aren't correct. Disclaimer, nothing on this is correct. It's just dummy data. But the idea is that facilities such as independent clinics, doctor practices, anybody that wants to offer their services can come and create a profile, and they can type out an overview. They can put photos of their clinic or their facility, have a nice image of the outside and inside areas too, and also list all their services. And that's really what we're getting at, is transparency. Transparent prices in healthcare are going to solve a lot of problems. So the idea is to list out all your prices, list out your terms and conditions, and anything else that you seem relevant for this, and offer your services up for sale. For instance, what we're doing in a way, in essence, is as a physician, when you perform a service, when you see a patient, you're doing something. and then you have to code for that something and bill insurance companies and hopefully get paid something back in return soon before 3 or 4 months is up. What we're doing is actually taking that same service that you're providing, and we're, instead of billing it, we're actually just letting you put it up for sale and have somebody buy it directly from you. So we're really trying to facilitate the growth of free market medicine. And this is what you can see right here. You list out all your prices. You can set up payment plans because what we have on Medoplex, and it won't be released in our initial pilot, but the second phase in February and March, we'll have the ability for you as a physician to communicate HIPAA-compliant communication through Medoplex with your patients. They can upload any documents they might need to you. You can review this. You can actually bring in a colleague to consult with the patient. You have scheduling features where you can actually schedule, or a patient could schedule an appointment here and purchase it directly from Medoplex, and also billing. So subscription billing, just payment processing, all of Medoplex. So really, you don't even need a website to do this. You can go here and just create a profile similar to like a LinkedIn profile or a Facebook profile, and you can treat this as your home on the web, and you can start getting reviews from patients. And we're actually focusing, let me get your feedback on this. We're focusing on different types of reviews, because you probably know, you go to Yelp or the physicians that are listening right now, you probably have possibly some negative reviews that aren't really a reflection of you. They're a reflection of the experience that patient had, possibly with the front desk person, possibly with the parking outside. Whatever that is, they may have given you a 1-star review, and that should not reflect on your ability as a physician. So what we're trying to do is break it down with kind of some better types of criteria to rate a physician. And while we're here, let's just talk about this. This is something that we did lay out for 3 particular categories for a physician. Listening skills. This is from a patient's point of view. Did you listen to me? Did we sit down and talk? Did you actually listen to what I had to say? Then did you explain the treatment and what's going to happen and the problem? Did you explain it well? Really just communication skills. And your medical competency. So did you actually seem like you knew what you're talking about? And those are the 3 we came up with. And this is from every other rating and review site online, kind of picked from what we thought was most relevant. So while we're on this page, I'm just going to stop right there and get your feedback. Does anybody have anything to say about these 3 criteria?
Well, could I ask a broad question? Why reviews?
Well, for instance, Amazon has indoctrinated us to pick everything by its rating, just about. Now, if you think about it, though, when you do buy a new vehicle, you're not just going to call the Ford dealership and say, "Hey, I want a truck. I'll pay for whatever it is." You're not going to do that. You're going to research the exact vehicle you want. You're going to read the ratings and reviews, comments, crash ratings. You're going to go to a couple different dealerships, the best price. You're really going to spend time and effort into finding the best possible vehicle, the safest vehicle for you. And without ratings and reviews, that's not going to be possible. So kind of the same side of, if you're looking for a physician that really needs some good listening skills, because you might like to talk a lot and you might need some hand holding through the whole thing, then you really want to look for somebody that is willing to hold your hand through a lot of these processes, where some physicians are more cut and dry and say, "Well, this is what you need to do. Just go ahead and do it." Everybody's different. So kind of getting to that mindset of patients are picking a physician based on these qualities. And I'm not saying these 3 types, these 3 categories are correct. That's just coming from a patient's point of view, what we would like to see. So how do you feel about ratings?
Well, I think as a patient stakeholder, it's great to see reviews. I think that the physicians who you want to sign up are going to have some concerns about being reviewed again. Just physicians in general are very sensitive to reviews, because often the reviews are either 1 star or 5 stars with no in between. And so we get reviewed on Press Ganey, we get, which is the standard, I suppose it's the gold standard, it's the silver standard, whatever. The other docs who are involved with Press Ganey can comment.
Well, the 2 questions are from Press Ganey, if I want to say listening skills. And I've been a hospitalist for 6 years. So those are so subjective. For, if you ask me, the negative reviews I've had is for people who have not got their prescriptions the way they wanted, and or safety issues where they didn't like the way I've managed the situation, and they've gone out on Facebook and put this long comments on. This is just for my DPC practice. It's nothing to do with what I've done before. So that's my personal experience on these reviews, which are very erratic. Just as I said, it could be a no star or a 1 star or half a star if it's available. Very, very inconsistent with what's happened. And again, these reviews are one-sided. There is no situational comment there, or no way a physician can, or is there a way a physician can respond to these comments in your in the Medoplex?
Oh yeah, for sure. We want this to be a two-way conversation. If you see down here, private feedback as well. So you can say, this doesn't necessarily fit in the 3 or 4 things that I could review, but I can leave some feedback for you to improve on. For instance, we're taking this from Airbnb. If you stayed in Airbnb, they have the public review and they also have the private review. And I use this a lot. When I do have a bad experience, but the experience I know is probably on the cleaning crew that comes in there. I'm not going to harp on how dirty it was when it's probably just somebody had a bad day at work cleaning up the place, and I don't want it to reflect poorly on the homeowner or something. So I use that with Airbnb, and we're taking this review concept from Airbnb for the most part, because they did have different levels of ratings and different criteria. So, I definitely see what you're talking about, and I've read a lot of articles talking about physicians thinking the same thing, just getting these 1-star reviews, and it reflects poorly on me as a physician. So that's why we're really trying to break it down to those 3 levels. And we also have something for the facility, to rate the facility. So
well, I have a suggestion for you, since you're still in design mode, because again, doctors are not going to be keen to sign up for another review place. However, if the physicians could say you had a list of 30 questions, and the doctor could say, well, at least for my stuff, I only want these 4 things reviewed. And then that becomes valuable because he's selecting what he wants, he or she, sorry, I want to be gender neutral, then it becomes a valuable tool for them because they're selecting what they want to be reviewed on. But if you decide a priori what you think doctors should be reviewed on, it just may make it harder for you to recruit doctors, and that's going to be one of your limiting things on there. But you can say, I don't mind if I'm reviewed on wait time from a scale of 1 to 5. I don't mind if I'm reviewed about cleanliness, but I don't want to be reviewed on medical competency and get these 1-star reviews. And if someone won't choose me because of that, I'm okay with that. So it's just a thought to do that. So that's my one input is think really long and hard about the reviews from both stakeholders' perspectives. Okay, so I'll just throw that out there. Let the doctors decide from a list of whatever what they feel comfortable getting reviewed on. Maybe it's nothing, and they'll accept that.
I like that idea. Okay.
I have a question too, just about service recovery. Would you be more apt to sign up if service recovery was part of this equation, so that that was more of the back and forth, or how do you weight that? How would service recovery come into play with doctors here on the Medoplex?
Could you define service recovery for everyone, Megan, just so we're all on the same page?
I think when something has gone wrong, so if you've got a complaint, if you've got a review that comes back that's negative, in my experience, we used service recovery as excellent or less than excellent. And anytime somebody marked the service as less than excellent, that prompted some sort of service recovery call to say, hey, what happened? What did we do? How can we make this better? So I think we're looking in terms of when things do go wrong, how we can mitigate it or make it better. How important is that here?
Yeah, we can definitely have that. I mean, that's just to add in with our messaging feature, where the user is, see, this is not going to be, the people will not have the ability to go in here and rate this provider just completely out of the blue. And we've discussed that, and I know a lot of like Health Grades and other doctor rating websites, they allow just anybody to go in there and rate this physician. We're trying to actually weighing that out, whether we should do that to kind of bootstrap this, but also take the approach of you have to be a verified patient in order to review this physician. Because, you know, a lot of people just go in there and just review something for the heck of it, and they never even purchased this product, or may have heard somebody talk about it. But, you know, I think that, I don't know how well that would work, Megan. I mean, I definitely see the benefits. I do know that like other like home and away or something like that. I was talking to my friend, he's got a few rental properties, and he said the same thing. People will leave him 1-star reviews for something that has nothing to do with him, nothing to do with his property. And I forgot which platform it was, but they allowed that kind of some service management recovery type thing where the company would actually follow up with the renter and ask what the question was, kind of mitigate the whole thing, figure out who's telling the truth, because, you know, you can't just remove a rating. You just can't remove it for the heck of it. So they would work together and kind of be the arbitrator in between that. And if they did agree that that was a false review, they would remove it. So we could look into that, but
so when I think of service recovery, like you're talking to, corporations like service recovery, individual physicians they may want feedback, but they're going to want to move on, and they're not going to be keen on spending a lot of time communicating with an angry patient. So if your target market would be direct primary care physicians, I may be wrong, and I'll let others voice up. I would, maybe there's another way to get negative feedback. I've always suggested that they should have direct email to the medical director if there's significant medical feedback that's copied to the medical director on the websites. But it probably depends on who your market is. COOs like service recovery, but the physicians are not going to be keen on that. You know, small private practice, you know, maybe that's an optional thing. I don't know.
okay. Well, let's kind of go further down this road with the ratings. Now, what if, think of it like a baseball card. You know, if you flip around the baseball card, you have all these different statistics on a player. Now, as a physician, could you think of 10 different statistics that you would like to showcase? Because you know that you're good at 10, 20, 30 different things that you have a really good success rate with. Would you like to showcase those stats?
So as a DPC physician, the whole purpose of a DPC practice is increasing access. I would like to comment on, like, if a patient has ease of access, how long has it taken for us to get back on a text message or an email? Those are the factors that matter. Now, when you look at listening skills and clear explanations, I have an hour appointment with each patient. So obviously that's enough communication going on there. Unless there are other barriers, you know. And medical competency, I feel like, you know, as doctors, we have so many state and medical board that is monitoring medical competency that I guess to term it differently, is the patient the right person to say if a doctor is competent or not medically? or what kind of a knowledge base they have to say how competent a physician is. It's not a peer, it's not an exam, it's not any of those things. So I guess from my experience, especially a DPC practice needs different thing or points to have ratings on other than these, because I mean I can provide, if you want to sit with me for 1.5 hours, I will sit with you for 1.5 hours, and that's what goes on in my clinic. So yes, it differs. If you are a specialist practice, you are doing the insurance model. Yes, there are time constraints, and they have a different time constraint for each appointment, and some of these things may matter there. That's my take on this.
Okay. Well, to be fair, also that third option, medical competency, this is actually added into the design. That wasn't part of the final say. So that was just part of the design. Since it was there, I just went with it. But I'm taking all of your points there, and I think y'all have some good points in terms of let's have 20 different types of reviews, and as a physician, you can pick that. I think that would be, I like that idea a lot. So we might move to that direction and see how that looks. And see if anybody utilizes it too. If everybody's selecting, no, I don't want to be reviewed, then kind of iterating, go a different direction.
Hey, Brennan, this is Matthew. If I could just give a different perspective, on two quick things. One on what you're showing here, and the second on the access issue. Yeah, so I'm 35 now. When I first started seeing my internist when I was 22 years old, I told him, I said, look, I want access. And if I can't get access, please tell me why I should even pay you. And he said, I have to give you access. He said, I only have 400 patients on my entire panel. I'm an academic. I have to give you nothing but access. I'm like, okay, you won me over. But yeah, access is what matters to me the most. If I can't get access, then that provider that I see better justify why I should still see them. Because if I can't get access, I'm going to want to see somebody else. So access is extremely important to me as a consumer. On the flip side of what you're showing here, Brennan, when it comes to these reviews, yeah, these reviews are it's great to have these reviews. However, as a consumer, I personally don't pay attention to them because I'm really skeptical of them, because I don't know if somebody's been paid to give these reviews. I don't know if these reviews are real. So most of the time, I personally don't pay attention to them. I personally instead just rely on my own physician and rely on what other people are saying about said facility my physician's at. I don't go on these reviews, on these public reviews, because I just don't know if they're real or not.
Yeah, that's a good point. I don't know if you heard me talking about it earlier, but somebody asked me to review their book on Amazon, and I didn't even read it. I gave them a 5-star review. So to your point there, yeah, it's really, really hard to trust anything there. But I do think that on Amazon, at least, when I see the verified purchaser, that means to me that, okay, I can actually trust this versus the non people that are the non-verified purchasers. You kind of got to weigh it with a grain of salt. But yeah, definitely, I get your point there. Kind of what we're just trying to do here is really weed out the very bad physicians and showcase the really good physicians. Just not everybody is created equal. Some physicians are better than others. Just like a baseball player, one is going to be better than the other. Really, I think you should be rewarded if you are better in terms of a higher rating, more credibility, more opportunities to be showcased on certain sections of Medoplex. I'm just kind of throwing things out there. But that's my take. I think that, once again, if I was really good at doing some certain things like treating patients, with this type of chronic condition. I'm really good at with this particular demographic. Maybe that should be part of that stat. Like I'm really good with males between 30 to 45 that are somewhat athletic, that have a lot of sports injuries or something like that. Where as a physician, sure, you can do a lot, but you're really good with a certain small subset of your patients. Maybe that would be something you can start highlighting different statistics on that. And I haven't seen anything like that to my knowledge.
Well, I think the key thing would be complication rate for the procedures, and that gets into, say you have a prostate biopsy and you put a number on there, whatever it is, $1,200 or $1,500 or $3,000. There's a percentage of people that are going to have a complication and are going to require hospitalization, and it's going to be a $25,000 prostate biopsy. So there's that needs to be addressed in the terms and conditions, because you want to know who's paying for that. All right, and it needs to be addressed up front. But indicating what percentage of people have to pay more than what the rate was would show that. So there needs to be a way to show complications in some way, and or bad outcomes or something. And that data is pretty sensitive. And it's who are you going to trust on that? Okay. Strep throat is one thing, but bladder biopsy is another thing. So it's something difficult to think through. How do you handle the 1 in 100? Because if the guy or gal sees 1,000 patients a year, 5 of those people are going to end up in the hospital with $50,000 bills if it's a real procedure. Even something like a laceration, it's rare, but every 5 years someone's going to have anaphylaxis and go out in a ambulance with epinephrine on board. And so there needs to be a way to kind of, and some of those things are just luck of the draw, and some of those things are competence. So there's a difficult problem with the outliers, and you need to think that through. Guys, I have to go, but Merry Christmas to everyone, and I hope I added some ideas, and I will talk to you in your next visit, okay?
All right, thank you, Matthew.
Thanks very much, Matt.
Have a good one. All right, so good points there, points taken and noted for our reviews. Now I'm going to hop onto the messages side, and there's really nothing to see here. It's just an idea of having the ability to communicate with your patients, and you probably already do this through any EHR. Well, you probably don't do this through EHRs, but with DPC, with direct primary care, now we only have one physician with us, Dr. Rowe. You're the only one left with us, so I'm talking directly to you now. With DPC, I think, well, let me ask you this. Do you have a big problem with referring your patients to specialists? And then once you do, kind of keeping up with that communication of what happened, what needs to happen, and really having, I guess, that communication loop ongoing. Are you having a problem with that?
Luckily, where I am, I have several private practitioners who have bundled cash pricing for the most common things. I have a big ortho group, very ready to see patients same day or next day. They have cash pricing. I have cardiology groups who see my patients. So yes, I have an EMR. I have a eFax that goes directly to the EMR. So I am pretty well connected. If something needs to be sent, I can send them. These are the groups I network with, so I know their phone numbers. I feel free to communicate with them if needed. But also I've set up a system where it's less, it's like referrals go through faxes, and I get their feedbacks too. So far it's been really good working with the people around me. But of course, there have been several instances, I think, in different, I guess it's regional. It depends on where you are and what systems are around you. I'm in Tomball, Woodlands area, where we have the Methodist Herman systems around, but a lot of private practitioners also among specialists who are not connected with the hospital. So there is a good network of for me to choose from.
Okay. Well, okay. While we're on that note, what is in your practice? What's a big problem you're having right now? Like, what would you love to have solved in terms of technology, just coordination, something? I know there's got to be some obstacle that you run into.
I think the main thing I'm working on for the 2019 is marketing. Do you market to employers? Do you market to the public? And I think that's a common question a lot of private DPC doctors are doing or working on, because of the, we try to keep the overheads low, but yet we need to grow. And I think that is the main thing that is going to bother me. The systems are in place. We have our flows, our clinic systems and all that. But the main issues are, how do you connect with the people out there who are looking for us or who don't know that they need us?
So yeah, I'm starting to see that a lot. I'm a part of some DPC groups on Facebook and LinkedIn, and that is a common question is, I'm taking this leap. How do I get out there and find patients? And a lot of times, if you have the average is you're going to take 10% of your patients with you from your previous patient panel. That's generally the average that comes with you to this DPC swap. And if you have 3,000 patients and you got 300, well, where do you get that extra 300? Because you really need about 500 to 700. And I know a lot of people are going the employer route, but then you're hearing a lot of negative things about having the employer pay for the patient for the employee, and the employee still doesn't have that skin in the game per se. They're not directly paying, so it's still in essence you're having that third party pay, and it kind of takes the impact out of that directly paying the physician. But I do know that a lot of employer groups are starting to realize, hey, this is saving us money, and it's also making our employees healthy and happy to connect with a DPC provider. So I'm seeing that trend continue in 2019. That's going to grow. I think a lot. Of course, I'm not the only one. There's a lot of larger companies out there that are starting to see that are wanting to commercialize DPC and scale that out. And one thing we're doing here is with Medoplex is also trying to be that marketing arm as well for you. Like for instance, your practice, you could list on here, throw up some nice photos, list transparent prices, and just to have somebody contact you and find you. Because there's a lot of people just looking. You'll see them on Facebook. Hey, what is this DPC thing? I love it. Where do I find a doctor? And you see that a lot. And commonly, the DPC mapper link is forwarded on, that's about it. And there's really not a place that you can go and find a surgeon, a MRI center, any type of physician that's offering their services for cash, just a transparent price. So if you really want to get the very high level, that's kind of what we're trying to do too, is allow a place for you to go and showcase your work and let people find you, and then just do everything.
So in Texas, we have the Texas Free Market Surgery Association, and they have listed, I think that is the one organization where we can go up and look at rates for surgeries, quoted by the surgeon, and then brief information regarding that, and of course associated with the FMMA from Oklahoma.
Right.
So that is our main contact, especially for surgeries. Of course, now I have this awesome orthopedic group, but otherwise for people elsewhere, if someone's just calling me out of the blue, not my patient, to ask me questions, at least in this surrounding area of Oklahoma and the Texas Free Medical Surgery Association, that's what I'm using right now.
I'd like to add a couple of things. I think people tend to focus on the larger employers, and we have to remember that the larger employers already have healthcare plans in place for their employees, and some are willing to look at DPC as an alternative or an option. But I think the market that gets forgotten a lot is the smaller employers that don't have Blue Cross Blue Shield or United or whatever. And they may have, let's say, 25 or 30 employees that they would love to be able to provide some type of health care for. that's the market that gets forgotten. And these are people that work, have full-time jobs, make decent money, could easily afford a DPC subscription each month for themselves and or their families. And the way to reach out to those folks, and I'm going to throw an estimate out there nationally, probably about 24 or 26 million people fall into that category. I'm not sure about the Houston market, but I know that the highest percentage of employers nationally are small businesses. Yes, the big companies get all the attention, but the majority of employees fall into that small business category. So a suggestion for you would be to reach out to the Woodlands Chamber of Commerce or local chambers of commerce who are supposed to be representing all their employers and all their members, and reach out to them and say, I'm a physician. I offer a very interesting alternative to high-priced. And again, this also addresses those folks that can't afford Obamacare. But the point is, reach out to the local chambers of commerce, tell them who you are, what you offer. They can use that to get to their members. It saves you a lot of time going door to door. The next thing I would reach out to are local realtors associations, local restaurant associations, other associations like that have these small businesses and small business employees. They represent them. So, and they're all looking for health care, but they can't afford the big, fancy, full tilt boogie, United Healthcare, Blue Cross, etc. So that would be my suggestion, to test the water with a local chamber and just tell them what you offer. It would be a great service for them to offer to their members, and it certainly would help you, I would think, in recruiting patients. And it's really not expensive. You have to pick up the phone, you set up a meeting with the local chamber president or whoever they designate, and see if you can get a few minutes with them. You don't have to pay for any advertising per se. I think it's a good grassroots start to look at people that can afford your service, and really don't have any other option.
Sure. Yeah. Chamber of Commerce is one of the organizations we talk to frequently about what we have to offer, how the scene of, basically position DPC, where it stands with insurance, healthcare costs, and the benefits of access, and control the costs of primary care.
Right. Okay, good. Glad to hear you're doing that.
So, Dr. Rao, you are in Texas. You are in Houston. Is that correct? Houston? Okay.
Yes, North Houston. Yeah.
There's a lot of DPC activity in Texas and Dallas and Houston. It's like, that seems to me, I know it's not ground zero, but it seems like that has had the fastest growth over the past.
Yes, I think we have the most doctors in DPC, especially at least on the map where you look at the DPC Frontier map.
Yeah, that's what I gathered from it too. And also with that, I just checked just a second ago, 963 locations. That has went up about 60 locations in the past since November the 6th.
Right. So just about a month.
Yeah, that's fast growth. And I'm sure some of them are slipped through the cracks. I mean, that's just people that actually go and list their practice, and word of mouth gets through. So I'm sure it's the actual number is probably much higher than that. But the thing is that growth is very fast. No, 2019 I think is going to be a good year for DPC, because every time I go, it seems like I educate every single person I talk to, because they say, "Whoa, that sounds awesome. Yeah. What is that?"
We are feeling some of it for 2019, and it is definitely getting more exciting.
It's we're definitely trying to help in this any way we can. What we're trying to do is provide this marketplace for you to list your services and imaging facilities. I know you're probably familiar with Green Imaging. We're going to be working. They're one of our first pilots, so we're getting all their stuff on here. So really going to start with imaging first. If you need to just pay cash price imaging, start with that, and then kind of grow it out. Move on to medications too, where you can buy medications directly online for really cheap wholesale prices. Labs, all this stuff is without insurance. and start growing out this free market economy where you can start to go into these large self-funded employers and they can start building their own plan based on the offerings they find on Medoplex. So they can kind of piece together their own offerings for their own employees, and it's all cutting out insurance. So it can be saving a lot of people money. So that's the idea there. So I would love to get you on board, just to get your stuff on there, get your a profile set up for you when we do launch it, probably, like I said, in January, February. But the idea here is to work with direct primary care physicians to help you all out in any way we can. I mean, we're trying to grow this movement. So we're trying to like lay the infrastructure down to allow it to grow. And I see a lot of obstacles to go down. Regulation is one, but a lot of times I think we have a lot of good regulation in place now. At least in 25, has it grown to 26 states yet, John?
I think it's 26, and there are several that are in process. But
I haven't heard too much about it. But
no, it's been kind of slow lately. I haven't reached out to Phil Askew to see if he knows of anything more, but I think we're still at that 26 number.
Okay, yeah, so still good progress. So we have a lot planned in 2019. And beyond just medical services, we've also got a lot of interest from physical therapists, chiropractors. We talked to one physical therapist. They had a group of about 300 non-physicians, chiropractors, physical therapists, nutritionists, dietitians, people that really focused on just health, the health of the patient. And they're already offering their prices for CAT. They're already doing this.
Right.
So they immediately saw the benefit of adding their listings and their profiles to this so they can find more people, more clients, and start growing that out. So we're starting to see an opportunity for much more than just medical services. They start thinking about genetics and microbiomics, and I'm really big into genomics. And I'll say this right here. 10 years ago, 10 years ago, it cost about $10 million to sequence a full genome. And I bought this for $199 on a Black Friday sale. Full genome sequence. And the idea is now that this is becoming feasible, financially feasible to get your whole genome sequenced, a lot more people are going to do it. Well, now that price point's come down, now there's going to be a lot of need for interpretation and personalized products and services based on your genomics. So you're already seeing a lot of like meal delivery services start to go there and customize meal plans directly for somebody with a specific illness or specific genetic makeup. So we're starting to see that could be a good opportunity for us as well. Not only to sell these kits, because you can white label these things for the same price, $300-$400, but to also offer the personalized products and services on the other side. You have a lot of physicians out there that are now, I'm starting to see, they're starting to focus on specific genetic issues. They're not necessarily a specialist, cardiologist or primary care. They're actually focused on a specific genetic problem. Like that is their specialty. And I think you're going to start seeing more and more of that, of people that are, I guess, becoming hyper-specialized in specific things. And you're starting to see them offering more services, more interpretation services, more personalized treatment plans based off your genetics. So I really think that's a good opportunity for what we have here at Medoplex, is to start focus on that personalized medicine. It's not just off the shelf. You can't just go to any old doctor and find that, but you can actually start finding that on a vast amount of physicians that we do have listed on this. So that's my take. I think that's a good opportunity for us to pursue later on. And it's only going to get easier and better for that too.
Hey, Brendan, this is Matthew. Yeah, John's right. There's about 26 states right now with actual DPC legislation on their books. There are more that are considering it. However, Congress, doing what Congress does best, is about to throw a monkey wrench into all this. There is a law right now that is about to go through that is going to allow HSAs to be a part of DPC. However, there's language in the bill right now that Congress is not changing that is actually going to go backwards on DPC and regulate it as a national health plan, which means that the 25 laws that are on the books right now are in deep jeopardy. I've actually talked to my state senator about this, who's actually in charge of the U.S. Senate Health Committee. And those laws that the states have done are in deep jeopardy because of this language. There's also new language that actually puts a cap on what DPC providers can actually charge. These are two pieces of language that is likely to stay in the bill.
Are you reading that? Can you send me that article if you have it available?
Yeah, Dr. Lee Gross, I have the article out to send it to you. Lee Gross put out the best explanation of this. But
Okay.
they have the votes to go on and pass it as it is, without fixing this. And it doesn't look like they're going to fix it.
And these are the codes. I think the first is the fee cap, and then the second is the particular codes that you can actually use the HSA for DPC. I think those were the two big concerns,
Yes.
which were added on to the original bill.
Yes, and also too, they also want to regulate DPC as a national health plan. Right now, I actually helped put together the law for Tennessee. Got that passed easily in 2016. And I made sure that there was language in that bill that said that our Department of Insurance cannot possibly touch this law at all, period. In other words, they can't regulate it. And now what they're basically saying is because somebody screwed up with the language on the House side, those laws are now in jeopardy. Which means that the states could go back and say, which means that the state of Tennessee and all these other states can say, yeah, today's a great day. We will regulate you as an actual health plan, is what they're saying.
Yeah, those insurance companies send their lobbyists to do dirty work.
Yes.
Well, that's why we all need to band together, and that's what I see now with the DPC community is pretty strong. I mean, you see the DPC Alliance, like 3 or 4 different groups out there that are trying to form. You have the Free Market Medical Association. You have us, what we're doing, and you have a lot of different people wanting the same thing but going on their own separate paths. And we're going to have to join forces at some point. Have a common rallying cry and at least come together in some aspect of having a shared plan or something. And kind of what I'm getting at is in February, we are having this meeting of the minds, I guess, 10 people or 10 entities with plans of world domination to fix American healthcare. And DPC is going to be a cornerstone of that. So we definitely need somebody. I'm thinking Dr. Craig Wax or somebody that's been to Capitol Hill and has given talks on this, and somebody that can rally the DPC community. But have people come together and let's come up with one plan that works for everybody. And as citizens of America, let's come together and crowdsource ideas. I mean, I can send out one tweet or one Facebook message and theoretically 1.6 billion people can see it. So, I mean, we can get the information out there and we can organize people and organize ideas and really come up with a solid plan fairly quickly, probably much quicker than our government can. So I think the idea is what we're going to start there in February is to start getting this in motion and figuring out how we can have this one plan, and it's open source. Everybody can see it. It's transparent. People can vote. People can say, I hate it. I love it. But the idea is to get everybody's involvement to really finalize a plan that works for everyone, and then ask the government, hey, we have something for you. We would like to help you. We would like to work together, and go that direction. So I'm just throwing that out there. That's kind of where we're going and what direction I think this one talk in February is going to look like. And it's something that we need to do too, because you can't I feel very strongly about just letting a group of politicians make the laws that impact millions, hundreds of millions of people for years. If they, it would be much better to get the input from everybody to begin with. So that's my rant for today. But that's where we're going and the direction we're headed. Once we get there, I definitely ask for everybody's involvement and participation in that. But other than the talks and updates on DPC, does anybody else have anything to add? Anything you want to talk about? Comments, suggestions? It is. Oh, you have one update. Anybody that has been beta testing Humantive, if you have an iOS device, that if you got an invite to, I'm not sure everybody got that invite, but if you did, I don't know if you got that invite last night, Matthew, but disregard that because that update
Okay.
is coming out in the next couple of days.
Okay.
All right. Well, other than that, I think that's about all I have to say. I was, like I said, just wanted to hit on Medoplex and what that was going to look like and just kind of some more sneak peeks. And we are going to be launching in the end of January. So if anybody knows of any imaging facilities or any direct primary care physicians or surgery centers that do want to get their services out there in front of employers and just the public, feel free to send them our way.
Sure, I'm going to send these to the common contacts I use. And if you can just send me an email, or I think we got it off Twitter, obviously, for this meeting. But if you don't mind sending me an email regarding a detailed or something about it, so I can forward it to.
Sure, yeah, I'll reach out to you. We just start a conversation there too, so you can have my contact information. All right, well, sounds good. Well, everyone, thank you for your time today, and have a Merry Christmas and a Happy New Year's. Enjoy the time with the family, and start planning for 2019 because it's going to be a big one.
All right, happy holidays, everyone. Bye.
All right.
Thanks, everyone.
Thank you.
Bye.
Bye-bye.
Bye.